some of the traumatic experiences that parents experience just come from them being people of color right off the bat. We know that there are systems in place that do not allow us to have equality and equity in the way in which we need it. And so those compounded, I would say, traumas really impact the families in these shelters. So I'm Greg Bailey. I'm the Parent Ed Consultant for FESCO. And I've been with FESCO a number of years, probably about 10 years. And I have the opportunity to go into the shelters and talk to parents about the importance of parent education. And it's something I really enjoy. One of the things that I've been able to realize since I've been working with parents at both shelters is the importance of mental health. I think that when people find themselves in a homeless situation, number one, is very traumatic. It would be traumatic for anyone. But what I've been able to understand is specifically to the African American or BIPOC community is that it's compounding the trauma that's already happening in these communities already. One of the things that I think is very important is to explore that, to let people know that these things that they're experiencing are not normal. In the African American culture or in the African American communities, we don't look at mental health in the way in which most people look at it. Sometimes there's a lot of myths behind it, that something must be wrong with you if you're going to see a therapist, if you're seeking help. People judge you, and so people in the African American and BIPOC communities don't tend to seek out medical help when they really need it. When we experience traumas, when we experience depression, even other mental health issues, we don't often go out and get that help because of the myths that follow those actions. And so we try to deal with it, and often we medicate. You see a lot of drugs and alcohol and other issues related to mental health that people utilize to try to deal with it in their own way. And it's really, really sad, because if you sought out help, there's opportunities out there with a lot of the free programs, the Kaiser, and some of the other clinical hospitals in the Bay that would allow people to kind of deal with those issues. But when there's a lot of negativity behind seeking that help, and when you've been told that it doesn't work and that it's a white thing to do that, people shy away from it, and so they don't really get the help that they really need. And that is really unfortunate. I just would like to say to my community, when you experience an injury, if you, like right now I'm dealing with a shoulder injury, it's a natural thing to go see a doctor. If you break your leg, you need to see a doctor. And so mental health should be in that same vein. When your mind is failing you, or you're having some issues that don't allow you to be your natural, normal self, it's the natural and normal thing to do to seek help. And so I wish that we could understand that mental health is, the mind controls the body. And so as we think, we walk. And so it's very, very important for us to seek medical help on all levels to be our best self. And that is the message that I would leave with my community.